cause of war. Something happens to the warrior's body. Many times it is happening to the brain. Fortunately, there's a new science that is unfolding right now in our time, and some are reporting amazing results.
Bad headaches at that point, but the first breath I took in the hyperbaric chamber, my headache went away immediately, and I lay there and cried for almost an hour during the treatment.
It is old wound care treatment called hyperbaric oxygen therapy. It's a medical treatment which enhances the body's natural healing process by breathing 100% oxygen in a pressurized chamber. In this way, the oxygen is dissolved into all of the body's fluids, the plasma, the lymph, and the bone, and can be carried to areas where blood circulation is diminished or blocked. The extra oxygen can reach all of the damaged tissues, help kill bacteria, reduce swelling, and aid the body's own healing process. Hyperbaric oxygen therapy can be remarkably effective in treating what some call the signature injuries of the wars in Iraq and Afghanistan, TBI and PTS. That's traumatic brain injury and post-traumatic stress. Now listen to this sobering statistic. The U.S. Department of Defense reported over 320,000 soldiers experienced TBI, traumatic brain injury, between 2000 and 2015. Now consider that the suicide rate among our nation's veterans continues at an alarming rate, up to 25 veterans per day. Many of these may stem from poorly treated or misdiagnosed brain injury and overmedication. Hyperbaric oxygen therapy can be an effective treatment for traumatic brain injury and post-traumatic stress, helping the brain to heal itself without the side effects of prescription drugs and the risk of overmedication and even addiction. It is the standard of care for the following 14 conditions which should be approved without question: air or gas embolism, carbon monoxide poisoning, gas gangrene, crush injury, acute traumatic ischemia, decompression sickness, arterial insufficiencies, severe anemia, necrotizing soft tissue infections, osteomyelitis refractory, delayed radiation injury, soft tissue and bony necrosis, comprised skin grafts and flaps, thermal burns, intracranial abscess, and idiopathic sudden sensory neural hearing loss. Here's the procedure as we understand it for obtaining VA-approved hyperbaric oxygen therapy, HBOT. First, the veteran must go to his VA primary care doctor to request alternative HBOT or other alternative treatments using the CHOICE program for TBI, PTSD, neuropathy, chronic back or neck pain, lack of sleep, and depression. Then, if referred, the veteran visits the specialist who is familiar with his condition and care. If the specialist agrees with the request, the VA primary care doctor should submit the HBOT request to the responsible VA hospital choice office. Then, once approved for HBOT, the veteran should receive a choice card and an approval letter with an authorization code from HealthNet. The VA-approved HBOT provider should also receive an authorization packet. HealthNet should then schedule the veteran's first treatment with the HBOT provider. If additional treatments are required, the HBOT provider should request those treatments by contacting HealthNet. When the veteran finishes the HBOT treatments, they should file within 30 days a request for travel mileage with a set per diem rate, and if previously approved, reimbursement for housing or hotel. The VA will only pay meals on days of travel to and from the HBOT provider's location. If more assistance is needed, the veteran is given, along with the choice card, a HealthNet contact phone number, 866-606-8198, or the VA website, www.va.gov/OPA/ChoiceAct/index.ASP.